Hello, this is Dr. Grande. Today the question is, what is the difference between Narcissistic Personality Disorder and Obsessive Compulsive Personality Disorder? So NPD as compared to OCPD. Now this is an excellent question, and a lot of times these two disorders are confused with one another. But when we look at the symptom criteria, it's not really clear why they're confused so much. So let's take a look at the symptom criteria first. When looking at NPD, Narcissistic Personality Disorder, we sometimes see grandiosity, a desire to have unlimited power or success, a sense that one is special and should be treated as such, a need for excessive admiration, a sense of entitlement, someone who exploits other people, someone who lacks empathy, envy, and arrogance. Now, when we compare these symptoms to the symptoms we see with OCPD, they are quite a bit different. So with OCPD, we see a preoccupation with details, order, schedules, lists, perfectionism to the point where it interferes with completing tasks, an excess devotion to productivity, being overly conscientious, so being inflexible in the area of ethics, morals, or values, being hesitant to discard objects that have no value, having difficulty delegating tasks, adopting a miserly spending style, and this would be with other people and with themselves, and being rigid or stubborn. So when we look at these two sets of symptom criteria, as I mentioned, it seems like they are fairly distinct. So why is it these two personality disorders are oftentimes confused? I believe there are a variety of reasons why these two disorders become confused with one another. And a lot of it has to do with perception, and some of the same characteristics are really in both personality disorders, but for different reasons. And the expression of the characteristic is a little bit different between the two disorders. So the first reason has to do with the perception of being supercilious. Now, with narcissistic personality disorder, this is what somebody's trying to achieve. They're trying to appear superior. With OCPD, this is really just a byproduct of the behavior. Individuals with OCPD have a real commitment to perfectionism, and sometimes this is interpreted as being supercilious. The next reason is lack of empathy. With both disorders, we do see a lack of empathy, but for different reasons. With NPD, we believe that an individual with this disorder usually does have the ability to empathize, but they don't use that ability. Now with OCPD, the same thing is true, but the way we usually think of OCPD is that somebody has the ability to empathize, just like with NPD, and they choose to empathize, they're just not very good at it. Oftentimes with OCPD, we see that individuals with this disorder have difficulty expressing themselves with body language, and sometimes this can be interpreted as not having empathy. So the lack of empathy is again more about perception with OCPD, just like what we see with superciliousness, than it actually being a characteristic of the disorder. Another reason these two disorders are confused is because we see a lack of generosity in both of these disorders. Now with NPD, that lack of generosity is with other people. Usually somebody with narcissistic personality disorder will indulge themselves. They will spend money on themselves, treat themselves, but not so with other people. With OCPD, it's more of a global effect. Somebody with OCPD would not spend money on others, but also they would not spend money on themselves. So again, we see the same characteristic, but it has a different feel to it with one disorder as opposed to the other. Another reason we see for the confusion is the condescending attitude that we sometimes see with NPD and sometimes with OCPD. Now, this condescending attitude can have the same feel with both of these disorders, but with NPD, it's usually more globalized. So somebody with narcissistic personality disorder will be condescending to a variety of people, regardless of their personality traits, the other people's personality traits. And this will happen regularly. This is a core trait of NPD, this condescending attitude. With OCPD, we don't think of it as regular, but more specific to certain situations. So we can see it sometimes and not in others, and it's specific to certain types of people in most cases. An individual with OCPD will have more of a condescending attitude with people that they determine as immature, irresponsible, or impulsive. So typically we think of this as individuals who are low in conscientiousness, that would be the impulsive part, or high in extroversion. That would be somebody who's overly expressive with emotions. So individuals tend to dislike, or sometimes tend to be condescending towards people who have those personality traits, but not necessarily people with other personality traits. Individuals with OCPD are actually quite respectful to figures of authority, for example. The next reason for the confusion with these two disorders is the commitment to perfectionism. And with NPD, we see this expressed as an individual who really believes they have achieved perfection. Now with OCPD, we see this more as a journey. Somebody's trying to obtain perfectionism, but actually people with OCPD are quite self-critical. They do not believe they have achieved perfectionism. Another point of confusion with these disorders is the referral source. A lot of times we think of NPD and OCPD as having similar sets of reasons for why people come into treatment. Not so much because they believe something is wrong and they want to change something, but rather because a family member, coworker, friend, or romantic interest has pressured them into seeking treatment. So this is a thread that ties NPD and OCPD together. This is a similarity. Now the last similarity I'll cover here, the last reason for the confusion between these two disorders, is the level of productivity we see in the work environment. When we look at all of the personality disorders, it's not unusual to think of Obsessive Compulsive Personality Disorder and Narcissistic Personality Disorder as the two that are most associated with being productive at work. I would say probably OCPD is thought of as number one in terms of productivity, and NPD would probably be number two. Now, of course, other personality disorders can be associated with career success as well, just not to the extent we usually see with OCPD and NPD. Now, the reason for the work productivity, or the perception of being productive at work, is different for both of these disorders. With NPD, we usually think of it as an abundance of confidence. Somebody with this disorder is usually quite self-assured, and sometimes this translates into people believing they're productive or into actual productivity. With OCPD, it's more of the dedication to perfectionism, liking orderliness, being meticulous, detail-oriented, and liking organization in general. These are characteristics that a lot of employers favor, and a lot of times an individual with this disorder can be highly productive at tasks, particularly those that demand a orientation toward details and do not tend to tolerate mistakes very well. So careers that demand precision. So again, with both, we see productivity at work, probably more so with OCPD, but this is a similarity between these two disorders. I hope you found this description of the differences between NPD and OCPD to be interesting. Thanks for watching.